So with cosmetic dentistry, porcelain veneers, how does the patient know what it's going to look like when it's all done, before it's done? And what's that process like?
Well, we always use photographs, Randy, to help the patients, to know where they're at, where they want to go. And we go through this process together. We utilize mock-ups. Sometimes I'll do what we call a mock-up right on their teeth, and I'll simulate what the final result's going to be like just in a matter of minutes. Or sometimes we might make a model and make what we call a diagnostic wax-up, and then I'll transfer that onto their teeth. So I literally have the ability to give them a glimpse of the final outcome before we've even touched their teeth.
Is that right? So
Yeah,
on the
absolutely.
consult, they come in and what's the discussion about? Like, what are the fears of veneer patients?
I think that one of the biggest fears with veneer patients is, what's it going to look like?
Because I feel like I could spot veneers walking down the street. Big, bulky.
I think you could spot the ones that weren't done well. That's the ones you can spot.
Okay.
The ones that were done well, I don't think you can spot them. That's my opinion. Patients that my hygienist said to me, has said to me on multiple occasions, hey, Dr. Sullivan, sometimes when I'm cleaning the teeth of the patients, I get tricked because I didn't realize that these were veneer patients that I had to look it up on the chart because they look so natural.
I mean, you're a big cosmetic guy. I'm not trying to side with you, but I've seen your photos, and they're some of the best, some of the best I've ever seen.
Well,
is it more art, more science? You have to have an eye for it?
It's all the above. Cosmetic dentistry is very much an art, okay? To be able to look at your smile, like I can look at someone's smile and I can tell you bam, bam, right off what's off about it.
Is that right?
Yeah.
Okay.
That's what I do all day, and I don't go around judging everyone's smiles. But if they ask me what, it's like I can look at a photo, I can look at your face, and there's so many things that go into that. Are the teeth in proportion with the face? Does it flow? I mean, I could go into a lot of detail about what we look for, but absolutely, there's an art to getting that outcome. And then the science comes in that the art, it has to look good, but it has to function properly too, right? You can't just put something that looks pretty and not have it function properly.
Meaning what? Eating?
Yeah,
chewing?
eating, or the wear patterns, or is it going to be subject to excessive breakage? Because I always say, you can't take a Porsche off-roading, right? So we want to make sure that it's engineered properly for the condition that it's placed in, or the patient's biting conditions. All those factors go into play.
And now, so in Arizona, you are known for cosmetic dentistry.
I think...
you do the local plastic surgeon. These are guys that could go to anybody.
Yeah, I think I've developed that reputation, over the years, and people know that, hey, that Dr. Sullivan has a reputation of really getting good outcomes, because one of the great things about being a cosmetic dentist is my work gets to go out and it's like a walking billboard, and so someone will say, hey, you have a great smile. And often my patients will say, hey, I have a great dentist. Why don't you go see Dr. Sullivan?
Now the lab, you place a lot of importance on the people that are actually making the teeth.
Absolutely.
That look real.
Dental labs, Randy, are very broad. All the way from the very small boutique artisan type ceramist to something that's shipped overseas that's cheap. So there's this production work, and then there's this high-end type of cosmetic, highly detailed work where this ceramist is focused on making that tooth mimic nature at the very highest level under magnification. I could show you photos and I could say, hey, which one of these is a veneer? And you probably couldn't tell the difference.
You can't tell.
No.